A tiny mistake nearly turned into a life-or-death crisis, and it could happen in any home. A 3-year-old girl from northern Israel is fighting for her health after receiving a dangerous overdose of acetaminophen, the common pain and fever reducer many parents rely on. But here's where it gets controversial. The overdose wasn't from anything exotic. It came from everyday dosing that quietly stacked up. According to reports, the child had been battling several days of high fever, vomiting, and diarrhea. In an effort to help, she was given acetaminophen at 3 times the recommended dose for her age and weight. She was brought to the pediatric emergency department at Rambam Healthcare Campus only partially conscious. A clear red flag that something was seriously wrong. Given how severe her condition was, the medical team quickly transferred her to the pediatric intensive care unit for close monitoring and supportive care. Once stabilized, she was moved to another hospital to prepare for a worst-case scenario, an urgent liver transplant, if her liver doesn't recover from the damage caused by the overdose. And this is the part most people miss. Acetaminophen, when overused, is one of the leading causes of acute liver failure worldwide, even though it's considered safe at proper doses. Dr. Mariana Maltado, who first received the child at the hospital, explained that the initial picture was confusing. The team suspected a mix of viral illness and dehydration, both common in toddlers with prolonged fever and gastrointestinal symptoms, and began supportive treatment. "We continued investigating because the test results didn't add up," she noted, highlighting how subtle and confusing acetaminophen toxicity can be early on. Then came a critical clue. Dr. Nadav Shalev observed a rapid and alarming spike in the child's liver enzymes within hours, a hallmark of potential drug-induced liver injury. This prompted a deeper review of what the child had been given at home. The revelation: the little girl had been given acetaminophen consistently for 5 days at a dose 3 times higher than what's safe for her size. On top of that, she also received acetaminophen in suppository form, without the caregivers realizing it was the exact same active ingredient as the liquid medication. In other words, 2 products, 1 ingredient, and a triple dose that quietly pushed her liver into danger. Why does this happen so often? Many fever and pain products look different. Syrups, tablets, suppositories, cold and flu mixes, but contain the same core drug. Labels can be confusing. Dosing tools can be imprecise. Dose strictly by weight, not just age, using the dosing tool that comes with the medicine. Avoid giving multiple products that contain the same ingredient. If symptoms persist beyond a couple of days or dosing feels unclear, call a pediatrician or a poison control center for guidance. Here's a thought that may spark debate. Are we doing enough to make pediatric dosing foolproof? Should manufacturers more prominently warn about duplicate acetaminophen products? Or should pharmacies flag potential overlaps at checkout? Some argue personal responsibility is key. Others say the system should better prevent these errors. Your turn. Do you think current medication labels and dosing guidance are clear enough for stressed, sleep-deprived parents? Have you ever nearly double-dosed a child without realizing 2 products shared the same ingredient? Share your experience. Agree or disagree in the comments.